Hello everyone and welcome to another class of Physiology for Engineers with Professor Gonzalez-Fernandez at Lehigh University. Today we are going to look at the knee joint, the structure and the different elements, the different tissues in the knee joint, and also we are going to look at the structure of the articular cartilage and the mechanical properties of articular cartilage. Finally, we are going to finish exploring arthritis, osteoarthritis, and how arthritis and inflammation affect the structure and the function of articular cartilage. So first, we are going to go into the structure of the knee joint. So the first structure that we're going to see in the knee joint is the femur. Then under the femur, we are going to have the articular cartilage. So we are going to have the two condyles and also the patellar surface of the articular cartilage. So here we have the lateral condyle. We also have the medial condyle. And then here we have the patellar surface. Then under here, the condyles, we are going to have the meniscus. So very important here, even though the articular cartilage is going to be hyaline cartilage, the meniscus is going to be fibrocartilage, which is a different type of cartilage as we've explained in the previous lecture. And then under the meniscus, we are going to have two different bones. We are going to have the tibia and also we are going to have here the fibula. Okay. So now we are going to look at the different ligaments and tendons that are going to stabilize this knee structure. So first, we are going to have the anterior cruciate ligament. So anterior cruciate ligament. And also, we are going to have the posterior cruciate ligament. Posterior cruciate ligament. Then we are going to have here and this ligament, which is the tibial collateral ligament. And then on the other side, we are going to have the fibular collateral ligament. Okay. Then here on top of the patellar surface, we are going to have the patella. And then we are going to have here the patellar ligament. And then on top of the patella, we are going to have the quadriceps tendon. Also very important, which I forgot, is that here surrounding the articular cartilage, we have the synovial space. which is limited by the synovial membrane or synovial lining, and also contains the synovial fluid, which is very important for the chondrocytes and the other tissue types in the knee joint to be hydrated, because there is not infiltration of blood vessels into this structure. So we need the synovial fluid in order to keep those tissues hydrated and also to provide them with enough nutrients. Okay, so once that we have looked at the knee joint, now we're going to look at the structure of the articular cartilage. Hello everyone. So in the second part of the lecture, we are going to talk about the articular cartilage. So we have different types of cartilage in our body. We have elastic cartilage in our ears and also elastic cartilage in our nose. We have fibrocartilage in the meniscus and in the intervertebral disc in our spine. And also we have articular cartilage in our knees. So this articular cartilage is also called hyaline cartilage. And this hyaline cartilage is highly specialized. It's divided into a lot of zones, and that specialization, that division into zones, is very important for its function. The function of cartilage is going to be to withstand the load when we walk and run, and also when we do exercise. So we have different zones here in the hyaline cartilage. First, we have the superficial zone. So this zone is characterized by the presence of collagen type 2, and collagen type 2 filaments that are going to be parallel to each other. So they are going to be aligned, and they are going to be parallel to the surface of the cartilage. Then we are going to have a transition zone. So in this zone, the collagen fibrils, they are going to be randomly aligned. And finally, we are going to have a deep zone. And in this zone, the collagen is going to be aligned, but in this case, is going to be perpendicular to the surface of the cartilage. Then after the deep zone, we have the tide mark. And after the tide mark, we have the subchondral bone. Then finally, under the subchondral bone, we are going to have the cancellous bone. Okay, so there are two very important elements here, extracellular matrix components, that are important for the function of hyaline cartilage and the structure of hyaline cartilage. First, we have the collagen. Specifically, we have the collagen type 2. So this collagen is important for the tensile stress and also for the shear forces here in the superficial zone. Then in the transition zone and in the deep zone, we are going to have higher content of another component, which are the proteoglycans. Proteoglycans and glycosaminoglycans, GAG. So these are important because they are negatively charged and very polar. And due to this negativity, they are going to bind a lot of water molecules. So that high presence of GAG in the transition and deep zone is going to bind a lot of water and create this hydrostatic pressure that it's going to protect cartilage against compressive stresses. So that's going to give us its compressive properties. Also, we have some proteoglycans and glycosaminoglycans in the superficial zone. One of the most important is lubricin, that is going to lubricate the top of the cartilage to avoid friction between the cartilage and the meniscus and the other areas of the knee. If we want to look at the mechanical properties of cartilage, we can do different tests. We can do a failure test. So in this failure test, we are going to plot the stress versus the strain, and then we are going to see how cartilage behaves. So first we are going to have a viscoelastic region, then we are going to have an elastic or linear region, then we are going to have this plastic region, and finally we are going to have failure. So this elastic region or linear region is really important because in here the collagen filaments are going to be aligned parallel to each other. And thanks to this region, we can calculate the Young's modulus. Which is the stress divided by the strain, and in healthy cartilage is around 300 kilopascals. Also, we can do a stress relaxation test. So in this test, we are going to apply a stress, and then we are going to let cartilage relax over time. So these tests show us that cartilage is viscoelastic because after we apply the stress, cartilage will take some time to relax and won't come immediately to its initial shape. Finally, at the end of this lecture, I want to talk about inflammation in the cartilage, arthritis, and osteoarthritis, which are one of the main causes of lack of mobility. And if you have someone in your family that is old, you probably have heard of this disease because it causes disability and a lot of pain. So here we can have different stimuli that are going to start this process of inflammation of arthritis. The most common are excessive exercise. Also, when you do exercise, you are overloading, so excessive loading when you are in the gym. Also obesity and age, and injury. For example, some injury in the cartilage that doesn't repair properly, or some injury in the anterior cruciate filament or the posterior cruciate ligament, which are really difficult to repair. So these injuries are going to destabilize the knee joint, they are going to produce friction, and that friction is going to originate inflammation. This inflammation is originated because the cells that live in the synovium, in the synovial membrane, the immune cells, the macrophages, the synovial macrophages, they are going to be activated, and they are going to secrete a lot of different cytokines and enzymes. And the cytokines and enzymes are going to degrade the extracellular matrix here of the cartilage. So it's going to degrade the collagen, and also they are going to degrade the proteoglycans or GAG. So this is going to affect the mechanical properties. This degradation is going to increase the strain a lot. And by increasing the strain, we are decreasing the Young modulus. And in an arthritic or osteoarthritic patient, we have a Young modulus of 2 to 100 kilopascals in comparison to the 300 kilopascals of a healthy patient. Finally, if it's not treated, this osteoarthritis and arthritis is going to develop incomplete destruction of the joint, and finally joint replacement with a prosthetic. Okay, so I think I'm finished with today's lecture. I hope that you enjoyed and you learned a lot about the knee joint and the articular cartilage. See you next week.